If it's very clumpy, it may have some problem making its way all the way to the uterus. But IUI bypasses that because the sperm is prepared and then directly inseminated into the uterus. So that clumpy characteristic of semen doesn't tend to interfere with how well an IUI cycle will work.
Okay, well, that's probably good news for them that they don't have to blame the clumping on the IUIs not working.
Right. And it may not be why natural conception isn't working either, because it may be irrelevant. It may not be interfering. Nonetheless, some people have observed that taking cough syrup, which helps thin out the mucus secretions of coughing, may help thin out the thickness or clumpiness of semen. So that can be a strategy you can try. Now, there's not like scientific studies on this, but it has been described, and you might try that and see just at home if taking a dose of bronchial decongestant cough syrup over the counter results in less clumpy appearing semen. But I don't think it's necessarily the reason IUI hasn't worked. And also remember, IUI success rates are maybe about 15 to 20% per try at best. So if IUI isn't working after 2 cycles, that doesn't mean that it won't work.
Right.
However, one other thing to check is the DNA fragmentation of the sperm. Sometimes the sperm DNA fragmentation can be high, which means that the DNA of the sperm in the sperm head is not packaged as compactly and as efficiently as it could be. And that can result in a failure for the sperm to cause a pregnancy or even a higher than normal miscarriage rate. It is not a factor that results in birth defects, but it can be a hidden reason that natural conception or IUI isn't working in the face of otherwise good numbers. And this is a sperm test that the man can get done on his semen at specialized labs. And if it is abnormal, if there's high degree of fragmentation, there are sometimes maneuvers that can be done to improve that, such as certain nutritional supplement like Fertile 8 or other blends, dietary changes more towards a vegan type diet, as well as frequent ejaculation. When a man ejaculates 5, 6, 7 days in a row, the semen towards the end of that period has a more normal DNA fragmentation, even though the counts are lower. But these are all things that could possibly be affecting a failure of IUI after a vasectomy or reversal with otherwise good counts.
That's amazing. And you have a fan in our audience today, plant-based addict, said Dr. Spitz is a legend. I have to agree.
I'm not old enough to be a legend.
No. A young living legend.
I'm not young either, but
a couple follow-up questions to that. That was such a great response. Is specialized lab. So I think that we really have to be able to point people in the right direction. You know, do you own a lab? Do they Google DNA fragmentation lab near me? You know, how are they going to find labs that actually don't just do a typical semen analysis, but actually do this specialized testing?
So most services such as IVF and IUI, those labs tend to either have a relationship with a lab that does DNA fragmentation testing, or they do them in their lab themselves. So if you are under the care of a reproductive endocrinologist who's doing IUI or IVF, they likely can get that lab done. For patients who come and see me or other urologists that specialize in infertility, we tend to have labs that we send our patients to get it done specifically. For example, I work with a lab outfit called ReproSource, and they have a service where the patient collects the semen at home and ships it in a special shipper to their facility in Boston. We get a turnaround time in about 2 weeks. There are other labs around the country that have similar services. So the best way to get the right lab is to actually have a relationship with a fertility doctor, male or female, who can then direct you to the right lab. There is a lab in Tustin called Fertility Center of California. They do a lot of semen-specific testing, and they also can send the specimen to get DNA fragmentation testing as well.
Okay, great. That was super helpful. All right, Jasmine's asking, her partner was diagnosed with a varicocele, And did you notice that I practiced that word since our last Instagram live? I stumbled upon
Very
that
good.
one, and I literally practiced it before the session. Varicocele.
I think it's like 100-point Scrabble word if you can.
Oh, I
actually put
like
together.
that. Well, I know how to spell it. I just couldn't pronounce it very well. But now it rolls off the tongue. Okay,
Yeah.
now her partner did have surgery to repair it, and we'll talk about what varicocele is first. But the morphology and motility has actually worsened in all the semen analysis post-surgery. Is that common with varicocele surgery?
No, it is not. Usually varicocele surgery either does nothing or it helps, but it doesn't typically hurt unless the person is checking their sperm very soon after surgery. So there can be sort of a shock to the testicle, and it may take a few months for the testicles to recover from the shock of surgery,
Sure.
but then start to benefit from the varicocele. So if a person gets a semen test, the surgery does result in a decline in semen parameters because at the end of the day, the surgery had a negative impact on the testicle. Maybe the circulation was compromised too much, whatever it was, there was this sort of subtle injury that occurred rather than a benefit. And then semen parameters get worse rather than better. And I have had that happen to my patients as well. But again, it's a small percentage of patients. About half of patients should experience an improvement in their semen parameters, maybe even more than half, but a sizable percentage, anywhere from 30 to 50%, don't experience an improvement. And if there's a decline, it could just be what we call kind of biological variation. That is to say, on some days your semen is better than others, and it's not because of something that happened. It's just because if you test it enough times, you'll see it go up and down, up and down, up and down. And it may be, in the case of this, did not help them, but it didn't hurt them either. And if they do another semen analysis and another semen analysis, eventually it'll kind of average out, and it's just kind of the same as it was beforehand.
Okay. Now, is there something in your book? You have some really great dietary recommendations. So somebody who's recovering from surgery, is that maybe one of the best times to introduce some of your dietary recommendations too, and some of those positive lifestyle changes so that their body recovers faster and so that they have some of those. Okay, good. So plant-based addicts probably would agree, huh?
Right. However, making dietary changes is not easy.
No, it's not.
And recovering from surgery is not easy. And so it would be best to ramp up with your diet before surgery, getting ready not only to have your body in optimal health to withstand the surgery, but also to recover as quickly as possible. But the best diet for the body, and from what I have researched and from what I have seen, is a plant-based diet. So that is eliminating or minimizing, to the extent that you can, animal products, which means beef, chicken, pork, but it also means fish, dairy, which means eggs, milk, cheese. So any animal-based product is best left off the plate if you can. And if you can't, if you can eat a large portion of fruits and vegetables with the animal-based product that you're eating, those fruits and vegetables will play defense in your blood to some degree. So if you can't be vegan, eat as many vegetables as a vegan.
Okay, so that's what I'm doing. So just to remind everybody who knows my journey, knows my story, I'm prepping for my second embryo transfer, and I'm on the older side of the spectrum. So I've taken on, through working with a couple of reproductive immunologists, eating 10 vegetables per day.
Great.
So when they first rolled this out to me, they said 10 servings. And I was like, I don't need 10 servings of food per day. That is so much food. I couldn't even fathom it. So I said, let me just do 10 different types of vegetables per day. But what I found is if I don't start with 7 or 8 different types of vegetables in the morning, forget it. Like by nighttime, I'm like not interested in having just a giant meal of vegetables for dinner. But if I start my day with that many vegetables, it sort of changes what my palate wants throughout the day. So now I'm like craving an apple, or like before lunch, and I'm craving different things. I'm craving cleaner, so it has changed things. But I'll tell you what, if you take away my eggs and you take away my fish, I might get real cranky.
Yeah. So these things aren't easy. And again, it doesn't have to be all or none. It really you will benefit the more you move in
Sure.
that direction, particularly if you make sure you're incorporating plant-based foods on the same
Right.
plate at the same time, because the effects that food have persist in our bloodstream for several
Amazing.
hours after that meal, both good and bad. There is a brain chemistry that we have to contend with when we're changing our diet. It's not just, is your stomach full and with volume of food, and therefore your stomach says, hey, I am full, you can stop eating now. There's chemicals in that food that interact with receptors in your brain that tells your brain that you're full. And if your brain is used to the chemicals on animal products and it's not seeing them anymore, your brain is going to say, hey, we haven't gotten our meal yet because I don't see those chemicals I'm used to, even though your stomach has 6 pounds of broccoli in it and it's going to burst. Your brain is still saying, where's dinner?
Right.
Now, those receptors will switch over, but it can take several months. And when they switch over, it will be amazing to the person who is doing this, how satisfied they feel with a plate of vegetables. It's as if they ate a regular animal-based meal. They will have the same satiety, the same feeling of satisfaction if they ate something.
Amazing.
But it doesn't happen overnight. It takes several months. You have to stick with it. It's tough.
Yeah.
But when you come through, there's a big reward on the other side, because you'll be able to eat in a way that's healthy without feeling like you're suffering.
That's right. That's right. I love that. I mean, I in the first week of doing it, people were commenting on my skin being clearer. And, you know, somebody was like, you're glowing. I'm not pregnant yet. And what I like about what you said is that it could take several months, but we often say to people, consider just sticking with something for the full sperm washout or the full egg development cycle, because they're about the same length of time. And then you're not waiting for that switch to happen. By the time you get to the end of your goal, you can kind of look back and say, oh yeah, I don't even know what point it was that I finally noticed that I was satiated and I wasn't paying attention to not being satiated, right?
Yes. And it's a very discrete goal. Food is not a very discrete goal. I mean, you can change your diet anytime, and people do all the time. But trying to get pregnant with an assisted reproductive technology that you are investing in emotionally and financially is a very discrete goal. And if along the way you happen to change your eating patterns, what a double bonus.
Yeah, exactly, because it's a lifelong, right? All right, so somebody that leads us right into the weight conversation. So someone is asking, you know, is it really true that losing weight can give you a better chance to conceive, you know, in any manner?
Well, it certainly is true with women because of the condition of insulin resistance and polycystic ovarian syndrome, and obesity is linked to insulin resistance and diabetes. And so going from obese to lean will reduce a woman's chance of having insulin resistance and having polycystic ovarian syndrome. So clearly there is a relationship there. In men, there is a relationship as well, because in men, the fat converts testosterone to estradiol, or estrogen like hormone, which then has a negative effect on the whole control feedback loop of sperm production. And not to mention, a very obese man will have an increased temperature around his testicles because of the excess compression and fat there. And there are other molecules that are unhealthy to the body in general that are probably unhealthy to the egg and to the sperm that are produced in fat cells. Fat cells are like little toxic factories spewing toxins into our bloodstream. Not all fat, but I'm saying excess fat. And so getting lean improves your fertility, but it also improves your overall health. And the two are ultimately very intimately related.
Makes a ton of sense. We need to go back to varicocele for a second, because someone is asking us, is varicocele a reason for a 0 sperm count? And I forgot to follow up with you, Dr. Spitz, on defining what a varicocele is, because I think there's a lot of people who don't know. Yeah.
So varicocele is just a fancy word for enlarged veins in the scrotum. We're familiar with the term varicose veins. Those are enlarged veins in the legs. These veins are, large and squiggly and sometimes painful. Exactly the same in the scrotum. You have large squiggly veins in the scrotum that are sometimes painful. And testicles have to be a couple degrees cooler than body temperature to produce sperm. That's why we have a scrotum, so that they can be outside of our body in a slightly cooler area than our body. Ovaries don't. Ovaries are just fine at body temperature. Eggs will form just fine at body temperature. So ovaries are tucked away nicely inside the human pelvis of the female, but testicles have to be in the more precarious position of the scrotum in the male, where they can be cooler and where the scrotum can relax or contract as needed to regulate the temperature. Part of the temperature regulation is how the heat from the hot arterial blood coming from the heart to the testicle gets siphoned away by the veins, bringing the blood back to the heart before that hot blood hits the actual testicle. So some of the heat is leached away by the veins going in the other direction, kind of like, two lanes on a highway going in opposite direction, and you've got a driver with hot coffee, and as the car is going the opposite way, he throws some of the hot coffee into that other car. By the time he gets to destination, he has less hot coffee. Well, when the veins are enlarged and squiggly, when varicose, the blood doesn't flow through them very quickly. The blood is flowing much slower. And so there's a lot less cars for that driver to throw his hot coffee into on his way.
Got it.
So the arterial blood is arriving in the testicle hotter than it ought to be. And the testicle is not getting 2 degrees cooler. It's getting less than 2 degrees cooler. And the sperm aren't forming very well. So varicocele surgery ties off all those abnormal sluggish veins so that the blood coming back up from the testicle is only going through those efficient, fast moving veins. And so the heat that's arriving to the testicle is less. It cools the testicle down. And so that's what a varicocele is, and that's what fixing it does. It cools the testicle down by getting rid of that traffic jam of hot blood coming back. And although it's controversial, and although you'll find different statements by experts about whether or not a varicocele can cause zero sperm, I will tell you that in my actual clinical experience, I've had men with zero sperm in their semen and even zero sperm in the testicles when I've done an operation to try to find it in the testicles, who also had large varicoceles. And when we had failed at getting any sperm from the testicle surgery, we then fixed the varicocele. And lo and behold, they became normally fertile and had children with natural conception with normal or close to normal sperm counts. Now, these are just two or three men in my practice. I mean, these are very rare scenarios, but it answers the question that yes, it is possible that the varicocele was the cause and that fixing it was the treatment. But for the majority of men with no sperm in their semen, varicoceles may either be only part of the cause, not a cause at all, and fixing them may result in some minor improvement that maybe allows sperm to show up in the semen, but they still require IVF. Or maybe it's enough to where they still have to do IUI, but occasionally, in a small percent, they actually are restored to normal fertility. And although you will find a lot of controversy on this, what I'm explaining to you is what I've observed in my own personal practice.
That was an excellent answer. And I do appreciate whoever you lined up to add the audio of the cars driving by right in the middle of your analogy. We'll have to thank those people. So what are some other reasons for a zero sperm count then that they should investigate before deciding on surgery or not?
Yeah, so there's a variety of potential causes for zero sperm count. Some are obvious, some are hidden and require actual workup. Some of the more obvious causes are going to be chemotherapy for testicle cancer or lymphoma, or other cancers that require chemotherapy that knock out sperm production, or chemotherapy and radiation. Or there might be an undescended testicle on one or both sides, and even though they are fixed, in most cases, if it's just on one side, a guy's fertility is restored, but in some cases, no. And if it's undescended on both sides, that tends to result in very low or sometimes no sperm count. Then there can be other factors that are genetic. A person can be born with a genetic cause that results in very little or no sperm production that's just baked into the genes. Now, they didn't inherit it from their parent per se. It's sort of a mutation that occurred, or it was a misallocation of genes. So a very common one is called Klinefelters, in which an extra X chromosome ends up getting into that sperm when the sperm are dividing. and that results in a male born with an extra X chromosome that impairs their sperm production, but they still make sperm just at exceedingly low levels that sometimes can be found surgically. In another case, there can be a mutation on the Y chromosome that spontaneously occurs, and the Y chromosome is the part that codes for sperm. And some of these mutations can result in very low sperm production, but still present, or very low sperm production and findable on surgery. But in other mutations, there is no sperm production period happening.
Gotcha.
So these are genetic causes. And then a varicocele, in my opinion, sometimes can be the cause. And then there's about 40% of guys that I see where we go through all the laundry list of potential causes. We do the testing for genetic causes. And lo and behold, we can't determine it. And one other cause I should point out that is more common is a hormonal imbalance. There are hormones that are secreted from the pituitary gland, which is about here behind the eyes, that send signals to the testicle, FSH, follicle stimulating hormone, and LH, luteinizing hormone, that stimulate sperm production and testosterone production. And there are conditions that can suppress the secretion of these hormones to where the testicles are not being stimulated. There's a genetic condition called Kallman's where the guy is born without part of that pituitary gland. And the way you know he has it is that sits right on top of the part that smells. And so he has no sense of smell either.
Oh my gosh.
And so this guy just doesn't have any stimulation, but if you give him FSH and LH injections, poof, testicles perk up and they produce sperm.
Does he smell too at that point?
No.
Darn.
No.
Oh.
But another common cause is opioid addiction or opioid use, not addiction, but because a person has a chronic pain scenario and he requires opioids. And opioids suppress the secretion of the signal from the pituitary, and that man may have no sperm in his semen and also very low testosterone, but it can be reversed with injections of drugs that mimic LH's action or injections of FSH itself.
Amazing.
So that, and then another very common cause is men who are taking testosterone. A lot of men are on testosterone. Yeah, a lot of guys are on testosterone because they need to be. It's legitimately. And then there are some guys who are on it, even though they don't need to be, and they're using it illegitimately. But either way, the testosterone tricks this part of the brain, the pituitary, to stop sending the signal to the testicle to make its own testosterone and to make its own sperm. And so they go down to zero sperm production, and it's reversible. If the guy gets off the testosterone, typically everything kind of comes back online, but it can take many months. And if they see a physician, they can be given medications to accelerate their recovery. It might be injections of HCG, which mimic the LH coming from the pituitary, or it might be Clomid, which tricks the pituitary to make more signal and can help speed that process along.
Let's go back to that weight conversation because you're doing such a great job explaining the hormone pathway. How does obesity disrupt that hormonal imbalance? So take it from that testosterone converts into estradiol, and then what happens with that pituitary pathway?
So the estradiol then goes and hits the pituitary and suppresses its secretion of the LH and FSH. And so it suppresses the production of testosterone. It's like a negative feedback loop, and it suppresses the stimulation of sperm production. And sperm requires testosterone to form, but it requires 100 times higher level of testosterone than what you have in your blood. And when your testicles are making testosterone, the levels inside the testicle before it escapes into your bloodstream is 100 times higher.
Wow.
And so if your testicles aren't making their own testosterone, the sperm will never get anywhere near what it needs. And when you're injecting testosterone, even if you inject twice as much or 5 times as much, you're still not even close to what the sperm requires within the testicle.
And I can't imagine that it would be a solution to be injecting testosterone directly into
it's impossible.
It won't work. Yeah.
It's impossible. So obesity is causing the signal that stimulates the testicles to produce their own testosterone to be dampened. Now, does obesity cause zero sperm count without any other cause? Not likely, unless a person is really obese, has terrible habits, drinks a lot, and is just in miserable shape. Yeah, maybe it can. I mean, I actually have had a couple patients in my practice who were morbidly obese, were drinking a lot, doing other recreational drugs. They were in their 30s, and they were a
Right.
mess. And they got themselves together. They lost a lot of weight. They stopped drinking. They started eating healthy, and lo and behold, they became normally fertile. I mean,
Amazing.
this is just a couple of patients in my practice. This is not a routine, and I wouldn't say that any obese male with zero sperm count is just because they're obese, because that is not likely the case. It's important to look for other causes as well. But certainly, if you're morbidly obese and you're drinking and you have a terrible lifestyle, you might be surprised just how much of an improvement would result from reversing those things. And in some cases, that may be all there is to it.
Amazing. And again, you're elongating your life just by taking on the obesity and losing the weight anyway. So there's so many benefits by just embarking on that path.
Well, if you're trying to be a parent, you want to be around for your children.
Right? You want to be able to chase them when they're 2 and 3, and now when my son is 7, he wants to be wrestling with me. I got to be able to do it.
Yeah, the stakes are higher for actually being the parent once the child is born, than just for having just achieving the pregnancy.
Absolutely.
Yeah.
When it comes to the varicocele surgery, at the same time, do you try to find sperm surgically since you already have somebody that's under anesthesia, or do you take it sort of step by step and say, well, let's try to do a sperm extraction first, or some other kind of surgical technique to find sperm before embarking on varicocele surgery?
So a combination surgery is logistically very difficult to put together. And the reason that is finding sperm in the testicle takes about 2.5 hours.
That's a lot.
That's a long operation. But the real challenge is not the time, it's the coordination. Because when we're looking for sperm in the testicle, if we find it, that sperm tends to be quite fragile and usually should be used within a day or it's retrieved or in the IVF cycle. So when we do these operations looking for sperm in the testicle, they're typically timed within a day of a woman's IVF cycle. And we have to be very nimble. We have to be able to access an operating room that can give us that time slot on very short notice, because we don't always know when the egg retrieval is going to be. And trying to grab 2.5 hours of surgical time with very short notice is challenging. Trying to grab 5 hours of surgical time with very short notice is often impossible. So although it can be a combination surgery, it typically
That makes a ton of sense. I just heard of a miracle story last week of a woman whose husband had hernia surgery when he was an infant and didn't know. And turned out that they had clipped right through all of his tubing when he was an infant. And no one knew. It was never spoken about. So, he was in his 30s when he finally found this out. And she demanded on testicular tissue freezing. And they said, oh, there's nothing here. There's nothing here. There's not enough. Or there was maybe 7. I think their story was 7 sperm or something. So she demanded that it be frozen. And then a couple of years later, they had got 1 baby from that sample that she insisted on being frozen, of just 7 sperm.
Well, that's the thing. Yeah. When we do these operations trying to find sperm, sometimes we literally only find 5, 6, 7 sperm total. But if one of the eggs that's injected by those sperm, one of those 5 or 6 or 7 eggs that gets injected by those sperm makes it through, you're good to go. Because the health of the embryo, although it's declined somewhat by the sperm being, as it were, weaker, really just depends on getting that DNA into that egg successfully. And so it is pretty miraculous in many of these cases, but it's also it's a very fragile and it's a very delicate situation. There's a lot of coordination and timing. And so many of my patients are disappointed to find out that they can't undergo this surgery ahead of time just to make sure there's sperm there and then commit their spouse or their partner to the IVF process. The reason being, it's if you got it, you really want to be able to use it, because you may not be able to freeze it.
And it's so expensive, right? And if she has to do a freeze all egg cycle, that's not what they signed up for,
or arranging for donor sperm backup, because some women are at an age where freezing their eggs are not likely to result in very usable eggs when they thaw either.
That's right. That's right.
Just as the sperm may not thaw well, the eggs may not thaw well.
Yeah.
And so, it is a complex, high stakes process, but there are plenty of success stories like you just conveyed.
Well, I was really grateful that Khloe Kardashian actually went on our friend Dr. Sherry's show on the Ellen Network called Lady Parts. And she acknowledged that all the eggs that she had frozen, and she's now 36. So she didn't freeze them, when she was 37 or 38 or 40. She froze them before she turned 35. None of them survived the thaw. And I was so grateful because we have so many celebrities talking about, I froze my eggs and yay. And yet hers was the harsh reality of what many of us are facing. I have 11 unfertilized eggs from the slow freezing times before vitrification, but then I have 5 embryos that are frozen as well. And that's, that seems like a lot. That's not a lot to work with, it's more than a lot of people have, and I get that, but it's certainly not, I think, what isn't a misnomer of quite the insurance policy people expect.
Yes, but you know what? That makes me think of something that I'd like to point out with regards to vasectomy reversal and in vitro fertility. In vitro fertility helps women get pregnant over and above what they could achieve naturally, but as a woman's age advances, the ability for in vitro fertility to improve their fertility declines, such that when a woman gets to be about 45, 46, there's really no more advantage or very little advantage that in vitro fertility will give them over natural conception. And after age 45, 46, it's really rare or pretty much unheard of that an IVF cycle results in a live birth. However, a woman who is over 46 and is still menstruating and has not reached menopause can still become pregnant naturally. So for men who have had vasectomies and have attempted and failed sperm extraction in vitro process with their spouses, and their spouses are now aging out for in vitro fertility, there is still an opportunity that their spouses could become, or their partners, I should say, could become pregnant if they had the opportunity for natural conception, if they had the opportunity for sperm and egg to get together every month, even though their fertility at age 47, 48, 49 is low, and the chances of a natural conception happening are low, it's still possible, but it's impossible if that man has a vasectomy and it has been reversed. So for couples for whom in vitro fertility is not working out, and it's due to, say, a female age factor, or for couples who are deciding to try to have a baby for the first time and the woman is already beyond the age of in vitro fertility, but still not menopausal, a vasectomy reversal is rational to consider. Even though the live birth rate will be low, it still offers an opportunity every single month that they no longer have with in vitro fertility. So it's an important concept for couples that are looking at trying to start a family where the man has had a vasectomy and the woman maybe is aging out for the IVF approach.
Makes sense.
The only option is not egg donor. It can still be natural conception, but with intercourse or IUI with ejaculated sperm.
Okay, now on that vasectomy reversal topic, if someone does go through the procedure, could there be scarring that leads to lower motility?
Yes. So the vasectomy reversal is reconnecting the tubes after you remove the blockage. And the diameter of those tubes is 1/3 of a millimeter. Okay, so think of that. Yeah. So think of a straw that's 1/3 of a millimeter diameter. It's a fraction of the diameter of a cocktail straw.
Oh my gosh.
And then think of cutting it in half and then sewing it back together. Not only do you have to be ultra precise in how you sew it back together, but you have to hope that when the body is laying down scar tissue, it doesn't overdo it.
Right.
And the body overdoes it all the time. That's why you can see scars. Scars are areas where the cells were laid down a little bit more than just the perfect amount. And that happens within the inside of the connection of a vasectomy as well. And if it happens too much, it makes that passageway too narrow. And as the sperm are trying to squeeze through it, they get injured or killed. And a smaller percentage of them are therefore moving.
Mm-hmm.
And so a vasectomy reversal can result in lower than normal motility because of the narrowing that can occur after the reconnection.
So now I'm thinking that we need to have you bring some supplies with you to our next Instagram live, because I'm trying to picture how tiny your needle and thread must be to sew something that narrow.
So the needle and thread are it's a micro suture.
Okay.
And it's very difficult to see this needle and thread with the naked eye.
Wow.
That's how small it is. And so I use an operating microscope that magnifies everything I'm looking at 20 times in order for me to place these sutures. And even at that magnification, I'm sort of right on the edge of what's easy to see. The average person who isn't trained, who looks under the microscope, would still have some degree of challenge seeing the opening of this clearly. But with a lot of experience, we're able to do it very straightforwardly. But yes, it is. It's microscopic in a way, not like a bench microscope looking at cells, but very hard to see with the naked eye. And in fact, because it's so hard to see with the naked eye, we have to be very careful with how we handle these needles after we've cut them so that they get returned off of the field of the surgery and not get lost.
Right, I'm sure.
If one drops on the floor, it can be almost impossible to
see
find
it. I bet, yeah.
But it's amazing how strong these sutures are. They're made out of nylon.
Amazing.
And as thin as they are, they can hold these tubes together. But I always tell the patients, don't ejaculate for 30 days, because when they ejaculate, those tubes contract and they're pulling out stitches. But even so, they don't tend to pop out, because not everybody listens to what I say, and so you don't have these blowouts. But it is a very
sounds like it. Okay.
Yeah.
Husband is 45 and had a vasectomy about 15 years ago. She's 36, no children. What do their chances look like with the reversal? And given her age is like spot on, let's hurry up and get a reversal and let them try naturally before moving on to IVF, right?
Yeah. So the live birth rate is the most important measure of success. You can look at technical success, and my technical success is probably about 95%. That is, I can line those tubes up, get all the stitches in properly, and sperm will flow through. But that doesn't mean a baby will be born.
Sure.
The live birth rate is actually linked very much to how many years it's been since a vasectomy. And there's no cutoff after which it's zero, but it definitely declines with time. And at 15 years out, the live birth rate is about 35%. Okay. So then we switch over to
which is still higher than a normal 36-year-old in nature, right?
Well,
month by month. Are you saying the course of a year?
I think no. 35% of couples who undergo vasectomy reversal, where the guy's 15 years out, will have babies born at some point, and 65% will not.
Got it.
That's what I mean. Now let's look at IVF. A 35-year-old woman undergoing IVF probably has about a 65% chance of live birth per try, and the sperm retrieval performed on the guy will be successful whether it's 15 years out or 5 years out.
Right.
The time since a vasectomy will not deteriorate the chances of sperm being retrieved unless something else has happened to his testicles, some other health issue, some other insult, or he had varicoceles that were slowly, making him infertile over the years. But all things being even, the live birth rate is going to be higher with IVF. However, there are other considerations. The cost, the process, various other issues come into play. So fortunately, a vasectomy reversal can be successful, and that option is available to that couple, but that's how you would compare it.
Now, when it comes to evaluating other options, he hasn't been having that sperm washout every 3.5 months because he's not ejaculating all the sperm out. He's ejaculating, but he's not ejaculating the sperm.
Okay, sperm washout is not really sperm leaving your body. It's just the production of sperm and how long that takes.
I see.
And the washout is eliminating nutritional, environmental, habitual factors that would have a negative influence on those cells as they're forming. it's a period of not exposing your body to junk while your junk is making sperm. Okay.
Okay, got it.
All right. So when a man has a vasectomy, he continues to make sperm on the
Great.
same timeline, the same amount of time, and it's the same new sperm that's forming. And all the old sperm that is not leaving his body is disintegrating into molecules that are getting reabsorbed.
Got it.
So
Okay.
when I do a vasectomy reversal, the living sperm that comes out the first time that man ejaculates is just as fresh as if he never had a vasectomy.
Wow, amazing.
It's not old sperm, because old sperm dies and disintegrates and gets reabsorbed.
Now, in her case, let's say that she needed IVF for maybe other reasons. Okay, so let's maybe she's already heading down the path of IVF. Is the most efficient path forward that he does a reversal to provide a semen sample, or to do a surgical retrieval of sperm if she's already doing IVF?
If a woman requires IVF and it is really not likely or impossible that she can become pregnant with natural conception, there's really no good reason to do a vasectomy reversal. And it is a quicker recovery if you have simply a sperm extraction surgery.
Got it.
It's a shorter operation, quicker recovery, less expensive when you're adding that cost to the required cost of the IVF.
Okay, that was very helpful. Thank you. So I love, you already addressed this one question. We have a few more that are coming up before we wrap up. But my mind is a little bit blown because we constantly talk about this whole concept of sperm washout. And I just learned, I think one of the most important things of the day, that it's not a leaving your body washout. So the vasectomy itself shouldn't have any impact on sperm health. And then the reversal itself shouldn't have any impact on sperm health, if I'm understanding the concept of, the washout correctly.
Almost. The vasectomy does have some effect on sperm health, but it's not clear what that is because we observe that live birth rates decline the longer it's been since the vasectomy reversal.
Okay.
And so there must be some effect,
sure,
but it's not well understood.
Okay.
However, you can improve the quality of your sperm whether or not you have a vasectomy, because this washout that we're talking about is washing out the bad exposures for a period of time, so that the sperm that are forming during that period of time, whether or not there's a vasectomy, are no longer exposed to those bad factors and are exposed to better, more healthier factors.
Super helpful. Okay, let's talk about semen analysis again for a moment. So you have a normal semen analysis, let's say normal DNA fragmentation, meaning nothing is amiss with that. What else on the male side might be leading to implantation failure or leading to, non-fertilization? We've heard about sperm antibodies before. So what are a few other things that folks should check out that might have to do with the male side, or how the female body receives the male side?
Yes. Sometimes a particular type of abnormality in the genes called the karyotype, which is the number of genes, can result in a higher miscarriage rate. This is some more recent understanding. And so sometimes if there's recurring miscarriages and the semen analysis seems adequate for fertility, and it was, because of pregnancy, yes, but there's recurring miscarriages, and there doesn't appear to be an obvious factor with the woman's uterus or with her egg quality, then it might be time to take a look at the genetics of the man in case there's this hidden factor. It's very uncommon, but it's a possibility. And then also, as you mentioned, looking at the DNA fragmentation of the sperm, which is not a measure of the guy's inherent genetics. It's a measure of how well the DNA of the sperm is packaged up.
And what about both of those fluids, right? Is there something about the seminal fluid that needs to interact right with then the cervical fluid? And can those two things be kind of contraindicated with each other? And how do you even tell that?
Well, probably the most common scenario with what you're talking about is the cervix can sometimes be blocked by the cervical mucus to where the sperm isn't able to get through the cervix into the uterus. And that can be bypassed, fortunately, very easily with insemination, which is not very expensive and not terribly invasive. But insemination is quite simply depositing the sperm past the cervix into the uterus with a little soft tip syringe that goes through that opening. And if there's blockage from the mucus, and it's bypassed. Or two, a woman can have a test done where they check if sperm is getting past the cervix into the uterus after intercourse. But if that is in fact the case, then the solution may be the insemination. Although I think also it's possible that using that remedy of cough syrup or ingredients in
right, little mucinex.
may thin the cervical mucus. And I think there are some nutritional supplements that sometimes might be tried to thin the cervical mucus. But that's really the main known issue as far as genital body fluids not interacting correctly. Now the seminal fluids are very important in how they get the sperm to the egg. What they'll do is they'll first have a reaction that coagulates the semen and makes it clumpy. And then, the purpose of that is so that it sticks onto the walls of the vagina after sex and doesn't just pour right out. But then sometime later, it'll make another chemical reaction that makes that clumpy fluid really thin so that it can start flowing up through the cervix and into the uterus and find the egg. It's sort of this two-step process.
So fascinating. This all happens.
It's fascinating, yeah.
Just naturally, everybody.
That's right. And the healthier a guy is, the more likely that those very important, very sophisticated chemical reactions, enzyme reactions, will occur properly.
Yeah, that's amazing. Oh Hey Canada is working on a feature-length documentary about erectile dysfunction. They want to be in touch with you. Oh Hey Canada, if you're on, just message me or message Dr. Aaron Spitz. His handle is at Dr. Aaron Spitz, and then he'll connect you with Jennifer and you guys can talk about that. But he would be fabulous for your documentary. So 2 last questions and then we're going to wrap up, and you're doing a phenomenal job. So thanks for hanging in there for us so long. Is it ever safe to use a hot tub if you're trying to conceive?
No. A hot tub doesn't cause any permanent damage, but it does cause a temporary.
That's a long time.
One session in a jacuzzi can reduce the motility and the quality of your sperm for up to 3 months. Now, again, not a permanent effect, but that's a long time to have to wait. So don't bother.
There's lots of other ways to get relaxed and be romantic.
Now, showers are fine, but hot baths and hot tubs are not. And the reason is, you remember at the beginning of our conversation, we talked about how the testicles have to be a couple degrees cooler than body temperature for sperm to form. And we talked about how the scrotum will slacken or contract to try to keep that temperature adjusted. And if you're in a shower, there's times where the hot is not on the scrotum and the times where it is, or maybe the heat is on part of the scrotum and it's not on the other part, right? Because the water's coming from one direction. And so your scrotum can react and kind of cope with it. When you're immersed in hot water, there is no escape from that temperature. There's nothing the scrotum can do to regulate that temperature.
Don't cook your balls. That's the bottom line. Don't cook your balls.
Don't boil your balls.
Don't do it. Okay. What about steam showers or steamers or steam rooms?
Yeah. Again, I think if you're in a room where there is just really no way to alter the temperature of any part of your body, it's not going to be good. So I think a steam room is less intense, than a jacuzzi, because your own scrotum can lay against your own thighs and the ambient temperature of the air is not going to get in between there the way water will. But it's not the same as a unidirectional shower, and you're kind of moving around and sometimes it's hitting it and sometimes it's not.
Right. Got it. Okay. Last question, unless somebody else has one, because we got to wrap up here, is if you have a normal than average sperm count, let's say you're like Superman sperm counts, does it actually increase your chance of conception more than, say, the average person? Or does it have no difference? All right.
No,
excellent.
It helps.
Okay.
Yeah.
Good.
So, the more healthy moving sperm there are, the greater the chance the sperm is going to reach that egg.
Okay, great. So that's why the sperm banks like to have high numbers, but we've seen those numbers declining over the years, right? So eat your veggies.
Yeah, the declining sperm count can be a bit controversial, but the redundancy that's built in with normal sperm counts is so high that it's okay. So people
Got it.
can be normally fertile with a sperm count of 13 million or a sperm count of 130 million. It kind
Amazing.
of just depends on that couple. So
Right.
it's the semen analysis can be quite tricky to make a prediction with.
Well, let's face it, men's bodies are just so much more damn efficient than the rest of us.
I don't know. We have as a urologist, I can tell you guys have
You
their
guys,
problems.
that's true. You've been in practice
Yeah.
all this time. So what's a good way for you, everybody to keep, following what Dr. Spitz is up to is just follow at Dr. Aaron Spitz on Instagram. Check out his book, The Penis Book, on Amazon. I don't think you're going to find 15 books called The Penis Book on Amazon. So it's not going to be hard to find him. And I'm telling you, it's a phenomenal book. It's very well illustrated. It's filled with humor, juxtaposed against complicated things.
It's got the big eggplant.
I did not plan this on purpose, but yes, I'm in aubergine today. Although now this is going to be my signature color whenever I'm on with you, Dr. Spitz.
Oh, you know what? I'll just show everybody. I just happen to have one laying around.
Oh, look at that. I do too. Yeah. Yes, but my tripod is on my book.
Only it's not written backwards when you receive it in the mail.
I know. What we're going to have to do is we're going to have to get mugs with the front cover of the book, but we have to do it in reverse. We'll do a mirror image so that it shows up correctly on Instagram.
That's right. That's right.
All right. Excellent. Well, as always, thank you so much. This was an absolute treat to have you back on the show, and I'll see you again next month. Everybody, if you need anything, find us at Fertility Answers app on both iOS and Android. And you can also direct message us and we'll get you in touch with one of our fertility advocates. We're here for you. We'll see you tomorrow at 4 p.m. and I'll see you in a month.
Sounds great. And thank you for what you're doing for everybody. I think you do a tremendous service. And I think the questions that you raise and the answers that we provide help a lot of people. So thanks for doing this.
Oh, you're so welcome. I sure hope so. All right. See you guys later.